Hello, everyone. Welcome to this interview with Healthcare IT Today. I'm John Lynn, the co-founder and chief editor at Healthcare IT Today. And I'm excited to be here talking with Renee Tarun. She's deputy CISO at Fortinet. Welcome, Renee.
Thanks, John. Thanks for having me.
Yeah, so security has become quite a topic, so I'm excited for this discussion today. But before we dive into that, tell us about yourself and Fortinet.
Sure. I've been with Fortinet for 3 years now, focusing on our internal security, our product security, and our policy and compliance. Prior to joining Fortinet, I spent over 20 years with the U.S. government. My last assignment was serving as a special assistant to the director of NSA for cyber and as the director of the NSA Cyber Task Force, where I focused on cyber operations, strategies, and policies across NSA, the interagency, and the White House.
Wow.
As far as some background on Fortinet, we were started in 2000. We're headquartered in Sunnyvale, California. We have over 455,000 customers worldwide, and every 1 in 3 firewall or UTM device shipped is a Fortinet appliance, making us easily the most deployed network security solution in the world. And we currently protect about 70% of the Fortune 100.
Wow.
What I personally like about our company is that we're an engineering company first. We were started by engineers. So we pride ourselves on the focus on innovation with heavy investment in research and development. From my perspective, we have the broadest end-to-end portfolio of cybersecurity solutions that have that high degrees of automation and integration built in. And we're the only security leader to design and build our own custom security processing unit that provides the best performance and cost value in the industry.
Wow, I mean, I didn't realize Fortinet was that broad. Yeah, I knew you had a lot of customers, but that's pretty impressive. And what a background and what a challenge being the CISO for a company that provides security. But that's kind of a topic for another day. But as we look at this, needless to say, healthcare organizations are stretched with a lot going on. So what are some of the priority security efforts every healthcare organization should be doing right now? Or maybe said another way, what are the security efforts that you see most healthcare organizations doing as kind of a baseline that, hey, you should be doing this, and if not, you're at risk?
Yeah, first and foremost, I think it's network segmentation. Segmentation can minimize the impact of an attack can have on your environment. And intent-based segmentation allows organizations to achieve, granular access control, continuous trust assessment, and end-to-end visibility and automated threat protection. It really also helps in managing those unsecured, Internet of Medical Thing devices. These devices are essential for patient care. However, many of them are headless and can't be updated to protect against new vulnerabilities, including the multi-vector attacks. So, traditional security approaches can't protect them. However, segmentation, that allows an organization to institute checks and policies at various points within the network to control users, application, and data flow. So it gives the organization the ability to identify and isolate potentially compromised devices before they can do damage or spread to additional segments of the network. The second piece is network access control. You really need to understand who and what is accessing your network. So to increase visibility of potential risk, healthcare organizations are implementing even more granular access control of their integrated security solutions in their architecture. So NAC settings can be based on the role, device type, time of day, location, and other device attributes.
Now that's great. The reality, I just read recently that every healthcare organization still has Windows XP, largely because some med device, required it, and they have to have that device. And so, I love that. I think that's where network segmentation and the solutions you're talking about are so important. Any other things that you see that are important for a healthcare organization?
Yeah, so a lot of the market forces and government policies are causing, significant consolidation in the healthcare industry. In addition to the merger and acquisitions, many entities form deep partnerships with other organizations. So they really need to enable these fast-growing healthcare networks to scale their operations securely and with high performance. Therefore, integrated networking and security within the remote locations with the main facility is a must. So organizations should look at using, secure SD-WAN that uses software-defined wide area network technology to enable, network traffic to move over the public internet or even over selected public, clouds using a virtual WAN. And SD-BRANCH solutions allow network access control, wireless access points, and networking hardware to integrate into the larger security architecture. In addition, insider threats. 56% of healthcare breaches come from the internal threat actors. So they really need to be looking to implement solutions to guard against the insider threat. So in addition to robust identity and access management supported by NAC, Organizations should look at technology such as deception technology and user and entity behavior analytics to help identify malicious behaviors.
That's great. And, I think, you've covered kind of the nerdy stuff, as I would call it. And it makes sense that you talk about a lot of the devices being Fortinet, but it seems like the people are the problem as well. I heard one CIO say, I'm most concerned about my 21,000 points of vulnerability, which was his 21,000 staff. What are you seeing in that regard as far as the people vulnerability?
Yeah, in addition to technology solutions, healthcare organizations can't forget about that human aspect. 45% of ransomware attacks last year targeted healthcare organizations, and many of these attacks were a result of social engineering or email-based attacks. And even since the beginning of COVID-19, we see the increase in user activity, of different groups and hackers increasing their efforts towards doing these, social engineering attacks. So you really need to have your personnel trained to be security aware, and so they don't take the bait and have some social distancing when it comes to the adversary and these malicious emails.
Yeah. Well, I saw some headline just as COVID-19 started that said that the ransomware people were going to leave healthcare alone, which, of course, we're going to trust hackers to tell us the truth there, right? No, I think it's, as you described it, it's just increasing. But what are some of the other things, I think COVID-19's changed healthcare in so many ways. How have you seen it change from kind of a healthcare security aspect?
Yeah, with the COVID-19, we saw some changes in really how the healthcare organizations they needed to operate. There was immediate demand for stand-up mobility solutions to support network connectivity for testing and triage sites. And there was rapid expansion of new clinical spaces for patient care in like non-traditional venues like civic centers. So it really required implementation and integration of networking solutions that could scale and were secure while maintaining consistent security controls and visibility throughout the deployment. In addition, telemedicine definitely spiked. So healthcare orgs, really need to be looking at their employees and how they approach security in regards to remote communication. Weak and easy to guess passwords aren't sufficient. So implementing controls like multi-factor authentication and secure VPNs, really were being considered by a lot of the healthcare orgs.
Yeah, it's amazing how the number of endpoints just exploded with telehealth, with remote testing, or as you said, the civic centers becoming hospitals. It's that's a security person's nightmare, of course. Increase the vulnerability framework. So, I think these are great solutions. I think a lot of the healthcare organizations. I mean, there's a whole spread. How effective are they doing at this? But what's really holding healthcare organizations back from doing it? From your experiences with customers?
So let's be honest, the stakes are very high in healthcare. I mean, if network changes are made that either disrupts the operation or a medical device is taken offline, it could be detrimental to the health and safety of patients, and that could even result in death. So however, on the flip side, not taking the appropriate actions, to secure healthcare, networks and data can ultimately have the same effect. So, really making sure that the network design and architecture are really well thought out and planned is something it just takes time with some of the organizations.
Yeah, and I keep going back to this in so many of my discussions, but it's really about healthcare organizations caring enough to spend the time on it.
In addition, I mean, with the insurance and government reimbursement programs, payments declining, healthcare organizations really have to, operate on tighter budgets and limited resources. So that's why it's now more than ever it's important that organizations look to streamline their network and security management, to gain efficiencies and reduce cost.
Yeah. That's great, and thanks for helping. I think you've given us a nice framework of 4 or 5 things that, if you're a CISO, if you're a CIO that's looking at what should we be doing to make sure, and are we up to snuff? I think you've given a good framework for that. So thanks so much for sharing these thoughts. I've been here with Renee Tarun. She's Deputy CISO at Fortinet. If you want to find more great health IT content, check it out at healthcareittoday.com. Thanks, Renee.
Thanks, John.